The views and opinions expressed on this program do not necessarily reflect or represent the views and opinions of 580 WCHS or West Virginia Radio Corporation.
And a very pleasant good morning to you. You're listening to Ask the Expert, WCHS, the voice of Charleston. I'm Dale Cooper. Thank you so much for tuning in on this Wednesday morning. A little warmer out as you're heading into work this morning. I always like to give an update on that windshield because, for me, that's oftentimes not having a garage. That's oftentimes my big delay in this morning. This morning, you're all clear. Windshield's not going to be iced over. It's kind of warm outside, so you can have that extra cup of coffee maybe before you leave the house this morning. But thank you so much for tuning in to Ask the Expert. I have a very special guest in studio this morning from the WVU Physicians of Charleston. I have Dr. Stephen Bush here this morning. How you doing, Dr. Bush?
Great this morning. Thanks, Dale.
Well, thanks for coming in, and thanks for spending some of your time with us this morning, because I'm really looking forward to our discussion. Of course, continuing kind of women's health discussion that we had last time with WVU Physicians of Charleston on, but with a little different tact. Explain a little bit about your background. Introduce folks to you, how long you've been practicing, where you're from, where you went to school, things along those lines.
I grew up in Ravenswood, and then I went to WVU for undergraduate and medical school and did my residency in OBGYN here in Charleston. And so I've been in practice 32 years. 12 years ago, I became the chair for the WVU OBGYN department here in Charleston.
Fantastic. So you've been practicing for 3 decades, and you've been. Thank you for staying in the Charleston area, by the way, because that's one thing that we don't like doing the brain drain here. So staying here is obviously a great thing. So you're practicing now. You're at the Women's and Children's Building here in downtown Charleston.
That's correct.
Is that
yes.
right? Okay. So and then your phone number, that's 830 Pennsylvania Avenue. It's Suite 304, but it's over at the Women's and Children's Building at the CAMC Women's and Children's Medical Office Building. The phone number for Dr. Bush is 304-388-1515, 304-388-1515. You can find out more information online, WVUPC.org. That's WVUPC.org. However, if you have any questions this morning, you can give us a call. Our number is 304-345-5858, 304-345-5858 for Ask the Expert. If you catch any portion of this program this morning and you want to go back and check out the rest of it, you can do so in our podcast. You can go to WCHSnetwork.com, click on the podcasts, and that'll take you to a roster of all of our shows, including this show this morning, which will be up within about an hour or so after we get off the air. So there's so many questions that I want to get to and talk about, but one of the things that we were talking about with Jeff before we went on the air was it seems like, and we're going to spend a good amount of time on this, you hear a lot of things about minimally invasive surgery when it comes to all sorts of areas, but women's health and some of the women's issues is one of the huge areas along those lines. And from what I understand, that's something you know just a little bit about.
Just a little bit, yes. I was one of the first surgeons doing robotic surgery for GYN here in the area. So it's in 2006 is when we started doing robotic surgery.
So you've been doing this for 12, 13 years now
yes.
already, and that's something that's kind of cutting edge that you see everybody kind of rolling out now. But that's something that I know you've instructed on it before. You've taught others how to do it, and it's something that you helped pioneer in the area. When we talk about, I called it minimally invasive, and robotic surgery is also part of that. What are we talking about along those lines? What types of procedures are included in that?
Mainly hysterectomies, although we do minimally invasive surgery for ovarian cysts, and it was actually moved into doing single-site surgery for sterilizations even. So there's only one incision instead of multiple.
And so anytime that you can make less incisions or there's less trauma done to the body during the course of the procedure, then your recovery is going to be a little bit easier and things along those lines too.
Yes, I always tell the story when I first started doing robots. I would do one a day, and I added 2 on the same day. So I finished my first case, and then, of course, she recovers. I finished my second case and went to find her in the hospital, and she wasn't there in her room. And I searched for her, and she was out smoking. So this was like 4 hours after her hysterectomy.
Wow.
So I was sold on the procedure then.
That's pretty incredible. So let's talk a little bit. Let's kind of illustrate the difference then. Not that there's anything wrong with traditional surgery, and do you have to qualify in certain ways in order to qualify for a minimally invasive or robotic surgery?
You have to take a course for it with the company, and there's simulation training modules that you have to complete so that you know how to to manipulate the robot.
So from the medical standpoint, it's continuing training where you're on the cutting edge of that technology and learning as far as it goes. When deciding which patients can take advantage of it, is anybody that needs the surgery, can they usually have it, or is there some other vetting that a patient has to go through?
Depending on the size of the uterus. So if it's an extremely large uterus, no, you really can't do robotics and would have to go back to what's the conventional open surgery, which is an abdominal hysterectomy.
And is that something that not every doctor necessarily does, the minimally invasive or robotics? So if somebody is looking for something like that, is that something that they can call you for without reference, or is that something typically you would need a reference for?
No, they could call the office, and we'd check and see if they would be a candidate for that or not.
And what's the difference as far as when we talk about the procedure itself and then the recovery? What's the difference as far as time under the things that you're doing traditionally and then as compared to the robotic surgery?
And when someone begins robotic surgery, the time is a lot longer actually than conventional surgery.
I see. Okay.
So there's a learning curve. Actually, we did a study on that. And for the first 15 cases, it takes the physician more time than conventional surgery. Then the next plateau is about 75 cases. And so at that point, you're really rolling along. So you're efficient and your cost of surgery is less. Then probably at 100 cases, you start doing more difficult cases and your time goes up again. So, but no, there's definitely a learning curve to it.
And then for the patient, you mentioned about a lady that had a hysterectomy who was out smoking 4 hours afterwards. So what is the time frame between when the surgery is complete, when you're having it done minimally invasive, and discharge and stuff? Is it outpatient? Is it a couple days, or what is that?
Some physicians actually discharge their patient the same day.
Wow.
In the evening. I'm somewhat old school. I'll come around in the morning at 7:30 and discharge them by 9 in the morning.
Yeah, so you give them overnight to make sure everything's good
right.
there, right? What traditionally, when you're talking about non-invasive traditional surgery, what's the time frame in the hospital?
It's generally 2 to 3 days.
So it saves quite a bit of time.
Yeah,
if you're a working mom or somebody that's looking to get back out there and you have limited amount of time that you can really take off, some sort of minimally invasive surgery is really going to be the right thing for you.
Right, and depending on the type of work the patient does, if it's an office job, they can usually be back to work within 2 weeks. However, if it's a job that requires lifting, it may be 4 to 6 weeks just because of having the surgery.
And we were talking a little bit before we went on the air. So if this is a retread of what we've already talked about, because I don't know the difference between what things are called, then just let me know. But the Da Vinci surgery, is that the same thing, or is that a different thing that we're talking about?
That is a robotic surgery.
That is a type of robotic surgery that does these same things, the hysterectomy and everything else.
Yes, it's the brand of the robot. There are several companies that are coming out with some competition, but they've not hit the market yet.
I gotcha. Okay, so Da Vinci is the brand that you're familiar with, or what we're talking
yes.
about specifically. I find the whole thing, as far as technology and medicine, to be I don't know anything about it from a professional standpoint, but it is something that in my reading materials, when I'm reading the news and stuff like that, medical breakthroughs in technology research, things like that are stuff that I, as a layperson, read up on a lot. So I like to try to keep up on that. And I find that the pace that technology is moving through medicine is pretty startling in a good way. I mean, it seems like you reach certain plateaus of discovery, and then a whole new area of folks get into that, and it makes it even better. Then you get to the next plateau. In the 30 plus years that you've been practicing, what are some of the huge benchmarks that you've seen kind of come along that have excited you?
I think the robot was probably one of the largest, and number one, it's fun.
Right.
It's a three-dimensional. You're in a console. You're setting. It's much more comfortable on the surgeon. It's magnified. You can see everything. So I think that was huge. One of the next steps was a single site incision. So where we're doing surgery through one incision with regular laparoscope, not with the robot. One of the things we're doing here in Charleston, which no one else, well, maybe 1 or 2 sites across the country are doing, we're moving to doing an application of laparoscopy through the vagina, so there's no incision.
Wow. I mean, and again, anything along these lines that you can do, it ultimately, once you get efficient at it, it helps the doctor because it becomes a quicker surgery, and then it helps the patient because they can get up on their feet and get back to work or whatever. I mean, in this day and age where not everybody has tons of personal days you can take off and things along those lines. Being able to get back to work within a few days is a lot better than several days that you have to take off.
That's correct, yes.
Let's talk just a little bit, because one of the huge benefits from the patient standpoint, not only do you get back up and back to work or everything else with robotic surgery or minimally invasive surgery, but also one of the things, the reason people don't go to doctors a lot of times is the fear, the unknown factor. I'm going to go in, I'm going to have surgery done. And although you know it as a medical professional that risk is very minimal with these things, as the lay public out here, we turn these things over in our head all the time. I try to just trust the doctor and not worry about it. I had some fairly minor head surgery several months ago that I was just getting these cysts taken off my head. I really didn't think anything about it. It was like the fifth thing in my mind. I just went to my doctor, got checked out. He said, okay, we have to do surgery. You're going to have to go under this. I'm like, all right, whatever. It really ended up being significantly more wound care on the other end than what I'd expect. I mean, it was actually a little uncomfortable and what I wasn't necessarily expecting. If I would have thought about it too much before going in for this, I may have found reasons to delay, because it wasn't something that I absolutely had to have done. I just wanted to have it done. I may have been like, I can put this off for a week. I could put this off for another couple weeks or whatever it might be. But when you're having minimally invasive surgery where you don't have to worry as much about the recovery, wound care, things along those lines, it really takes a lot of that fear out of having the procedure done.
Well, I still think there's some fear with undergoing surgery.
Of course, anytime there's going to be, right.
But no, I mean, we do talk to the patients and tell them that the recovery is going to be much quicker, and I think that does kind of alleviate some of the fear.
If you have any questions this morning about minimally invasive or robotic surgery, you can give us a call. Our number is 304-345-5858, 304-345-5858. Dr. Stephen Bush is over at the WVU Physicians of Charleston. His address is 830 Pennsylvania Avenue, of course, at the Women's and Children Medical Office Building. Phone number is 304-388-1515. That's 304-388-1515. More online at WVUPC.org. That's WVUPC.org. Dr. Bush is Associate Professor and Chair of Obstetrics and Gynecology at West Virginia University School of Medicine at the Charleston campus. So it's a great opportunity for you to call in at 304-345-5858. I do want to transition and talk a little bit more generally about women's health. And go ahead. I'm sorry. Did you have something else?
I had something else to add. One of the things
please.
with the opioid crisis, the minimally invasive surgery really is, helps with that, because we really don't need to use many opioids for pain. So basically a non-steroidal, which is like Motrin or Aleve or something like that, is all the patient usually requires. So I mean,
wow.
That's another big advantage given the.
I'm glad that you brought that up, because unfortunately in West Virginia we have to do everything a little bit filtered through the lens of the opioid crisis. I mean, it's something that we have to manage, and as a doctor, not having to prescribe opioids for recovery is one of the first steps that you can take in helping to mitigate some of the proliferation of the medicine. So in this, not that you would anyway, but in this case where you can just go with a Motrin or something along those lines, I mean, that is a big deal, especially around here.
Right.
And to be able to keep that down a little bit. So yet another great benefit. And again, if you have any more questions this morning, you can give us a call, 304-345-5858, 304-345-5858. I always find in talking to a gynecologist, someone who takes care of women's health and babies and things like that for a living, having babies is something that mankind has been doing for a long time. It's something that you would think natural progress, but there's so many different things as a woman is going through. I have a 7-month-old, so to me, in watching, and we had a 7-month-old after 6 miscarriages, a few losses, fairly mature losses. It was heartbreaking, but once my wife got to the point where she was carrying and everything was going, as a dad, as my wife as a mom, and everything that's going on, although we've been doing this for thousands upon thousands of years, it's a nerve-wracking experience for the parents. There's so much literature out there. You kind of know within certain ranges of how things are going to go. It doesn't matter. As a dad and as a mom out there with all these different things coming down, it could be a little bit. It's a little frightening. It really is.
Well, it's quite stressful for all involved, actually. Although it's such a joy once the baby pops out. That's one reason I'm still doing it, because it's such a joy.
Just that moment when you have a healthy baby and you're able to give that to mom and dad's there in the room. I mean, it was a moment that I'll never forget. That's for sure. When you talk about in West Virginia specifically, though, and you start dealing with, I mean, you've done this so many deliveries, so many women that you've taken care of. What are some of the, I guess in West Virginia, some of the things that you see time and time again that either mothers can take control of themselves to be a little bit more healthy, or things that just environmentally creep up that you see that you have to treat from time to time again? What I'm trying to get at is if you have a pregnant mom out there who maybe is suffering from something or not real sure what's going on, maybe some things that they can keep in mind as they progress on their pregnancy.
I think one thing that you see about in the media is access. And I don't think really there's that much of a lack of access in this area. I mean, we will be happy to see patients if they call in and we can get them, appropriately seen by one of the physicians. I think one of the more discouraging things, of course, is the opioid crisis again. And then we see the mothers that are addicted, and of course this affects the baby as well once it's born and it's addicted. And there are programs to hopefully get the mothers off, and Dr. Calhoun with our clinic has a program for weaning off of the opioids rather than continuing on a methadone program or Suboxone program. So I mean, they have a good bit of success for the patients that actually enroll in their program.
And that's fantastic too, because I know, I mean, I'm glad that I did it, but at the same time, there's images and things that I'll never forget. When my daughter was about 3 or 4 months old, I watched it's just a 7-minute documentary that was on YouTube about babies who are addicted to opioids and some of the treatments, and mostly it was just showing how pitiful these poor babies are. And just a few minutes of seeing that on that end of things really gives you a lot of pause about exactly what the ramifications of this crisis is, because it's not just the adults who, a lot of people are like, well, they're making their own decisions. I mean, there's this whole debate on at what level we need to care for the adults that make these problems. There's no debate for these children, because it is miserable looking what they have to go through if they're going through withdrawal after being born. Yeah,
if you go in the nursery and you see these babies withdrawing, it gets to you, seeing them
definitely.
Crying and shaking, and yes.
I mean, I can imagine as a doctor how much it must, because I mean, your whole mission in life is to heal and to make better, and to see something like that. I mean, just for me as just a dad, seeing that is heartbreaking. I couldn't imagine as a doctor exactly what it's like to go through. As far as other medical conditions go, or what you run into, is there anything that in West Virginia that you find? I mean, we know about some problems with the opioids and related issues there. Is there anything in West Virginia that you find are fairly common as far as physical difficulties with pregnancies?
Well, again, since we're one of the leaders in obesity, that we do see quite a bit of obesity in pregnancy. I think, of course, across the country that's a problem as well. But the obese patient needs to realize they're placing themselves at increased risk for blood pressure issues, increased C-section rates. Actually, if a C-section is done, the incision can become infected because of being obese. It's just there's a lot of issues with that.
A couple of things I want to touch on that when we come back. What I want to do now is I'm going to go ahead and take our break. We're going to come back. We can still take your phone calls, 304-345-5858, 304-345-5858. But I want to get into some more detailed questions for Dr. Bush about some of the things that he does, and also taking your phone calls if you have any questions about women's health, about pregnancies, health during pregnancies, anything along those lines. And also, I mean, if you need counseling on opioid problems while being pregnant, or someone that you love is running through that problem and you want to call in, you're welcome to do so. Also, I know that medical issues can at times be a little bit sensitive. If you want to use an alias, you're more than welcome to be John or Jane. We're okay with that. You don't have to give your real name over the air. However, if you do follow up with the doctor, you'll have to give your real name then. You're listening to Ask the Expert this morning. Dr. Stephen Bush is here. He's an MD, Associate Professor, and Chair of Obstetrics and Gynecology at West Virginia University School of Medicine here on the Charleston campus. We're going to take a break and be back right after this. Well, actually, we're going to take Bill's call first. Bill is calling in this morning from South Charleston, and he has a question. We'll let Dr. Bush field that question. Bill, good morning. How are you doing this morning?
And enjoying this beautiful day, and not so much a question this morning as it was, Dr. Bush may not remember us. My wife had gone through 5 miscarriages. We now have 2 beautiful children. It's been 9 years since I've seen you, but I wanted to say thank you.
Oh, you're quite welcome. Thank you for calling.
Bill, I'm with you there. My wife and I went through similar issues. We had six losses before we had our beautiful baby Essie, and it was the most wonderful moment of our life. But those 6 losses leading up to that point were some of the lowest moments of our life. So, Bill, I understand where you're coming from. I could tell that you were emotional, but thank you so much for calling in and sharing that a little bit about Dr. Bush. Let's go ahead and take a break. When we come back, we'll have plenty more to talk about. Your phone calls as well, if you want to comment. Testimonials are great, too. I've been requesting questions, but if you have a testimonial like Bill, you're more than welcome to call in. 304-345-5858, 345-5858. You're listening to Ask the Expert this morning. I'm Dale Cooper. Dr. Stephen Bush is here in studio with me from the WVU Physicians of Charleston. We'll be back right after this on Ask the Expert, 580 WCHS, the voice of Charleston.
The Peyton Law Firm. Tom and Harvey are well known for what they accomplish for clients. If you were injured, they help you collect money from the person who was at fault. Sounds easy, but a lot of work, a lot of consultation, a lot of research goes into presenting your case. If you've been injured, put over 60 years combined courtroom experience of Tom and Harvey to work for you. Peyton Law Firm. Online at PeytonLawFirm.com.
Hey everybody, Chris Lawrence here, inviting you to join me this and every Saturday morning on 580 WCHS for West Virginia Outdoors, presented by the Peyton Law Firm. I've got the very latest information of interest to West Virginia sportsmen and some really cool outdoor stories from all over the great Mountain State. Plus, if you can't catch us on Saturday, don't forget the replay at 5 o'clock Sunday afternoon. It's West Virginia Outdoors, presented by the Peyton Law Firm and brought to you in part by Rodney Loftus and Son Contracting on the voice of Charleston, 580 WCHS.
Good morning. Road construction on I-64, my marker 39 at the Scott Depot Tays Valley interchange. The westbound left lane will be closed until 3 p.m. and the eastbound left lane will be closed until 5 p.m. through Friday. Heavy equipment and workers are on the roadway. Use caution in the area and expect delays. On I-77 northbound and southbound at my marker 99 at Greenbrier Street in Charleston, contractors are performing highway lighting repairs at the Route 114 exit and on-ramps. Watch for crews and equipment on the shoulder and ramps. This is Jeannie Kay on the voice of Charleston, 580 WCHS.
It's about 18 minutes until the top of the hour. You're listening to Ask the Expert, WCHS, the voice of Charleston. I'm Dale Cooper. Thank you so much once again for tuning in on this Wednesday morning as you're heading into work or maybe sitting at your desk or at home enjoying a cup of coffee, listening to Ask the Expert this morning. In studio with me is Stephen Bush, MD. He's the Associate Professor and Chair of Obstetrics and Gynecology at West Virginia University School of Medicine on the Charleston campus, located at the CAMC Women and Children's Hospital Medical Office Building on Pennsylvania Avenue. His phone number is 304-388-1515, 304-388-1515. Online, more information, WVUPC.org. That's WVUPC.org. You can call us this morning. Our number is 304-345-5858 on Ask the Expert, 304-345-5858. I will simply answer the phone, and then you can ask Dr. Bush your question, because I certainly am not the person you want to answer your question this morning. Again, that number is 304-345-5858. I did want to circle back around briefly to the obesity issue that you brought up right before the break, because, as you said, unfortunately in West Virginia, we're either the most or the second most obese state. It seems like every year when these numbers come out in the country. And obesity does lead to some either complications or potential complications down the line. If someone is going into a pregnancy and they are obese, number one, can you manage your weight while pregnant? In other words, can you help yourself out while you're pregnant by trying to lose weight? Or if you're already pregnant and obese, should you just maintain the pregnancy as best as possible and hope that you can work things out?
The recommendations for a normal pregnancy is a 20 to 25 pound weight gains. And someone that's obese, it can be down to 10 to 15 pounds. So we don't request them to gain as much. And quite often, for some reason, they begin eating healthier during the pregnancy and end up not gaining any weight during the pregnancy. And we see that quite often.
When you talk about some of the complications that can come up for someone who is obese and they're pregnant, I know that one of the things that I've heard about is, for example, when you're going under anesthesia, like if you need like a C-section or something like that, there's certain weight parameters with that on where it can be done at, like as far as being under anesthesia?
Only maybe for the bed itself. It's a weight restricted bed, but we have those beds at CMC because we deal with the obese populations. That's not really an issue.
And then there's things like high blood pressure, preeclampsia, things along those lines, and these can lead to problems with the actual baby, right?
Correct.
What is that something you can manage while you're pregnant? Like you can take medicines to help with your blood pressure and things along those lines?
We can give blood pressure medications during a pregnancy. Of course, diabetes is a problem too with the obese patients. We can manage the blood sugars during the pregnancy, and as long as someone's under control and we monitor the pregnancy closely, they can have a healthy pregnancy.
In those cases, you might be a little higher risk, and so you might see the patient more often. Like instead of every few weeks or something like that, maybe you see them weekly, or instead of once a month, you see them every 2 weeks or something. You increase the frequency a little bit?
Yes, we do. We term them a high-risk pregnancy, and again, the baby's typically monitored every week from 32 weeks on till delivery.
But so even then, if you're out there and you're in a situation and maybe you're obese and you're pregnant, if you're not seeing if medical care is not something that you typically get, and maybe you're trying to manage your life a little bit, but if you're overweight and you're pregnant, you really need to make sure that you're under care and supervision to make sure that that baby's going to be as healthy as possible.
That's correct. Bad things happen if you're under a physician's care.
Do you see that happen on occasion where someone comes to you kind of late in the pregnancy and maybe they're having complications either from obesity or something else, and they have some problems somewhere midterms?
Generally, the obese patient tends to show earlier. It's typically the opioid patient that shows up as a drop-in.
And what are some of the things that you can run into? I know that if you do have the high blood pressure, I mean, sometimes you have to deliver early and you have a baby that might have to go to NICU for a while or something along those lines under extreme circumstances? Extreme,
yeah. Someone could get the preeclampsia, which is high blood pressure and potentially have seizures if it's not controlled. And that can occur as early as 24 or 25 weeks in the pregnancy and would require an early delivery. And, of course, the baby would be in the NICU for some time or potentially not survive.
But one thing that I think that even somebody that's having a fairly typical or a normal pregnancy, or they're not dealing with any special issues, if you're relatively young or if it's your first time, my wife and I, our child was both of our first child. I'm 44, she's 34, so we're a little older in life having our child for the first time. And although, again, like I was talking about earlier, pregnancies happen all the time. I mean, the birth rate's incredible. This is something that everybody's pretty familiar with. We still found ourselves early on, even because we were going through fertility treatments and stuff. So we had, we were in constant contact. Sometimes you're just not sure what to do next. Where do you go from here? Once you find out that you are pregnant, first of all, should you always rely on a home test? If you're somebody looking to get pregnant, should you go in and get a blood test right away? How is the efficiency of those things?
You should rely on your home test, but you always should have a secondary check at your physician's office to confirm. And then,
so once you know for sure that you're pregnant, maybe you're only seeing your family doctor, something along those lines, you should have a family OBGYN that you've been seeing most of the time, and you would typically continue care through that doctor throughout the pregnancy?
For the OBGYN, correct?
Yeah, right, yes. Correct, right. So you would stay with your family OBGYN if that's the case. Or if you've been looking to change or if somebody's retired, I mean, that would be the optimal time to go ahead and try to find, I guess, a new doctor if that's what you're looking for. Typical care for someone in early stages of pregnancy with no other complications, how often do you go to the doctor to get checked out? When do you start checking for things? When do you do ultrasounds and start checking for heartbeats and stuff like that?
We generally like our patients to come in between 6 and 8 weeks because that's the point we can actually do an ultrasound and see the baby's heartbeat. If they come in earlier than that, you generally can't see the heartbeat, and so there's some tension and wondering if it's a normal pregnancy or not until the time comes that you can visualize by ultrasound the fetal heart.
I know another thing, and you probably, I'm sure at different times in your career and probably still now, get panicked phone calls from patients who are experiencing something that seems a little odd. I know one of the things that we had is my wife suffered some clotting, some bleeding. I think she was at about 12 weeks with our child. That was about the same time that she had experienced some problems before, and we ended up losing one of her pregnancies. When this happened, we panicked. I mean, it was like the end of the world. We thought that it was all the bad news in the world. Our fertility consultant, stuff like that, occasionally there is a little bit of bleeding that isn't necessarily going to be tied into something major happening, but you have to stay in constant contact with your doctor to make sure that these things are right.
That's correct. I mean, there's bleeding occurs fairly often. Actually, the cervix bleeds very easily during pregnancy, and any trauma to the cervix, intercourse, whatever, or heavy lifting can cause some spotting. We generally tell our patients not to worry unless they're soaking a pad every hour, because it's fairly common to have some bleeding.
Yeah, and that was one of the things, again, being later in life, you think as a 40-plus-year-old man and my wife being in her 30s when she was pregnant, it seems like things that are fairly commonly known. Yeah, there's some bleeding during pregnancy and stuff, but man, when you're experiencing it for the first time and you're thinking about it, it's a little scary. It really is. Your first inclination as the father, as the husband, my first inclination is, let's go to the hospital now, load them up, let's do it. And found out early on that that's a little bit of overreaction. You can contact your doctor and kind of be walked through some of this stuff. And it ended up with her, of course, everything was fine. It was just normal. And there was an extra layer because she was going through some fertility treatments and stuff, and that increased her sensitivity to some things and caused some things to happen that were a little bit outside the scope of norms. So every situation's different, I guess. And that's probably, again, in over 30 years of practice, something that you've ran across is that although delivering babies is delivering babies, I'm sure every patient brings their own challenges and is a little different.
That's correct. There's very few patients that don't have one challenge during their pregnancy. And as you mentioned, the reassurance from the physician's more
definitely
important. And usually we get the phone calls in the middle of the night, but and it's a reassurance at that time.
It seems to me that's when the emergencies happen, or at least that's when we feel like the emergencies happen is in the middle of the night or at some inconvenient time, unfortunately. Quick tips for those that are pregnant out there, regardless of their health range that we've talked about. We talked about obesity and some different problems like that, but just some general tips that you've found over the course of your practice as far as for healthy pregnancies and for healthy moms during the pregnancy. Is there like activity levels that you should, all things being equal, because again, I know things could be different where you have to do bed rest or partial bed rest or something, but if you're having a healthy pregnancy and there's no other red flags, should you exercise a little bit while you're pregnant? Is there things that you should look out for? What's a good balance as far as that goes with someone who's pregnant?
I mean, I always recommend my patients to exercise, and I suggest walking 1 to 2 miles a day. They could even take low-impact aerobics and swim or ride a bike or stationary bicycle. They shouldn't, once they're pregnant, stop things. Unless there is a high-risk issue that's instructed to the patient not to exercise. Right.
Again, your mileage may vary depending on your personal circumstances. And for how long can you continue doing that? Like if you go to the Y every day at lunch and you're working through the first couple trimesters of your pregnancy, can you continue to do that as long as it's not overly high-impact stuff?
If someone is continuing to work out, yes, they can continue their workout. You just wouldn't want to start a workout program in the third trimester.
So that was the next thing I was going to ask. If you suddenly are health conscious because you're pregnant, that's great. Like you said, a lot of times moms start eating a little healthier and stuff along those lines. That's okay, but you don't want to suddenly start doing CrossFit when you're pregnant, right? Because your body's just not going to be able to handle both things at the same time.
And the new evidence is showing there are runners that are pregnant. It was once thought that you shouldn't run after 12 weeks, and so there's been some evidence showing that if they are a runner, they can continue to run.
Oh, really? Okay, I didn't know that. So, of course, always continuing to study and learning and going forward it's always good to be able to incorporate that kind of information. Any other advice that you can give, just kind of just from experience as far as managing a healthy pregnancy with moms that are out there, things that they should be looking for during their pregnancy that you give advice for your patients?
Again, just an appropriate diet and the exercise, and to notify the physician if they have any concerns, and that we will all get through the pregnancy as a team.
Let's talk a little bit about the experience at your office when folks come in to see you. Do you have associates that work with you? Do you have midwives or anything like that works with you as well? Or when someone comes in to see you, generally, what's the progress that they go through during the course of the pregnancy? Who do they end up seeing and different benchmarks that they reach for that?
Well, they may see the physician. They may see our nurse practitioner. Of course, the MAs or check the patients in and do a lot of triage for us when the patient comes in, so they get to know our MAs quite well. So, I mean, again, it's a team effort.
I know that Darren, my wife, and our experiences that just our ultrasound techs, we became very close because, again, because the fertility treatment, we went in every week and we got ultrasounds done. She was high risk as well. We got to know our the ladies that did our ultrasounds so well by first name, became Facebook friends, share pictures with them, so on and so forth. But having that kind of a family practice where you're going in and you're familiar with each step along the way, you get to know the folks who do your intake, you get to know the nurses who take your blood pressure and different things, and then of course the physician that you're talking to. Having that kind of intimate experience at the practice, that is a layer of having a healthy pregnancy.
Definitely. Again, just the feeling needed and comfortable in your visit. That's very important.
And then as a dad, or as a support figure, and you have people that are coming in with their wives or their partners, and they're the potential dads. What advice can you give to the potential dads to the support that they can offer for their pregnant wives?
Chill.
That's so true.
Most of them are a little more uptight than the patient themselves.
That's so true. I know that I was at times obsessive about different things, and again, being older probably helped me in that regard in some ways because I trust medical professionals, and so when people are giving me advice, I'm not constantly questioning it. If they tell me what's going on and here's the data and here's what we're going to do, I'm totally on board with that. But man, every little hiccup when I'm at home, somebody, are you okay, honey? What was that? Is everything all right? She probably got sick of hearing that. So just chill out. Your wife's body generally knows what she's doing. Your wife will be able to tell you if something's going on. So you don't have to be so obsessed about the thing. But being a dialed-in dad's not the worst thing in the world that you can be. You just got to learn to measure that a little bit, I guess, right?
Yeah, and I always ask the dad if they have a question, try to include them in the discussions, and so.
Well, we oftentimes did that where we would trade questions before we went in to see the doctor. We would say, well, what do you want to ask today? What have we come up with? Or sometimes we even took notes. Like early on in the pregnancy, especially, we actually took notes, and then we would come in and we would bring up like our note program on our phone or whatever. Okay, well, this is the stuff we came up with this time. We have a question about this and a question about this. Maybe it was a little exhausting, but at least we were trying. We had questions and we were trying to make sure we were doing the right things. Does that type of thing ever bother you, or is more engagement the better?
Yes.
Yeah, so it's kind of like the thing, there's never such thing as a dumb question. I mean, if you're looking for your baby's health, there's really no such thing as a dumb question. Ask your question and make sure that you get the right answer for it.
And understand the response as well.
We've been having a great conversation this morning. Just a couple minutes left in the program. Might have time to work in one more phone call if you want to try to call in, 304-345-5858, 304-345-5858, either a question or if you want to give a testimonial, you're more than welcome to do that. Dr. Stephen Bush has been my guest this morning. He's the Associate Professor and Chair of Obstetrics and Gynecology at West Virginia University School of Medicine here on the Charleston campus, located at 830 Pennsylvania Avenue, Suite 304. Of course, that's the CAMC Women's and Children's Hospital Medical Office Building over in Pennsylvania. We all know where that is. 304-388-1515 is the phone number, 304-388-1515. More information online, WVUPC.org. WVUPC.org. Dr. Bush has been practicing for over 30 years here in the area. So much experience that we've been kind of delving into a little bit on the air this morning. If there's folks out there looking to make a change of doctors, or they just moved into the area and they're looking for a new OB in their area, something along those lines, can they just give your office a call and start the progress if they're interested in coming to see you as a patient?
Sure they can, yes.
So you are accepting patients
yes,
now?
Yes, we're accepting new patients, yes.
So that same phone number, 304-388-1515, will get it done?
Yes.
So that's if you're out there and you're looking for a doctor. Dr. Bush is accepting new patients now, so you're more than welcome to give him a call at that number. Again, that's 304-388-1515, 304-388-1515. Find out more information online, once again, at WVUPC.org. That's WVUPC.org. Dr. Bush, thank you so much for your time this morning. We learned a lot. I think that we got a lot of great information out there for folks along the lines of women's health and babies' health, and especially when it comes to the special things that you do over there with the minimally invasive surgery and the robotics. We appreciate your time this morning. Thank you so much.
Well, thanks, Dale. Really enjoyed speaking with you today.
Absolutely. Hopefully we'll do it again soon. Thank you so much. That's Dr. Stephen Bush from the Associate Professor and Chair of Obstetrics and Gynecology at West Virginia University School, and Chair of Obstetrics and Gynecology at West Virginia University School, and Chair